Like any other virus, the one that causes COVID-19 is constantly changing through mutation. Sometimes, these mutations result in a new variant. If the new variant then is able to spread more easily than the virus that currently is in our communities, it will take over and become the dominant COVID-19 strain. We don't know yet if this is the situation with a new variant called Omicron, but many scientists suspect that it indeed will spread more quickly and over several months will spread widely in our country. The CDC and researchers around the world are monitoring the situation and tracking the spread of Omicron, and at the same time are working to understand more about this variant, learning about the severity of disease it causes and how protective vaccination or previous infections are in preventing illness. While we learn more, the best action people can take right now to protect their health and the health of their loved ones is to get vaccinated. Vaccines are very effective against the Delta variant, which remains the major COVID-19 virus in the United States and worldwide. And vaccination is an important tool to reduce the spread of infection and slow the emergence of new variants. Vaccines also reduce your risk of severe illness, hospitalization, and death from COVID-19. It's also important to continue using multiple layered strategies to prevent the spread of infection. This includes wearing masks where appropriate, minimizing exposure in crowded settings, and importantly, staying home when you are sick. COVID-19 viruses change, and we need to remain alert to potential threats. But with vaccination and other measures, we have the best chance to control the pandemic and limit its impact in our communities.